I see you all logging in. We are all on mute right now as we get things set up. We'll start in about 5 minutes. So we will be with you in just a moment. Thank you for joining us. Okay, everybody, let's get started today. For those of you who don't know me, I'm Jaime Barnhart. I'm the Executive Director of the Washington, D.C. chapter of CAI. Welcome to part 2 of our COVID-19 webinar, Essential and Non-Essential Services. So I just want to take a quick moment to thank you all for attending our virtual education, and thank you for your continued support of the chapter in this new environment. Thank our chapter partners, our education sponsors, and of course all of our panelists today for doing this round 2. So many questions, we couldn't do it in one round. And with that, I'm going to turn it over to the chapter's education manager, Suzanne White.
Good afternoon. I'm Suzanne White, Education Manager for the chapter, and glad to see how many of you have returned for part 2 of our discussion on managing through the COVID-19 crisis. Today, we will cover association financial solvency, business continuity, honoring existing contracts, and the feasibility of moving forward with scheduled work. Given the CDC guidelines and the stay-at-home orders that will remain in place over the next several weeks, what is the best approach and strategy for keeping our communities financially stable while making progress and properly maintaining them? The Washington Metro chapter is pleased to welcome back our distinguished panel of experts to help us address these issues and answer your questions. We received way more questions than we can get to in an hour, and a number of the questions were repeats from our first town hall. The link to the recording of the April 9th session was included in your final confirmation for today's session. Please use it to refer back to the topics covered in that session. And as always, we are thankful to our education sponsors as they continue to support the chapter's educational mission. 3 of those partners are taking part in today's presentation: USI Insurance, National Cooperative Bank, and Wintrust Community Advantage. With that, I'm going to turn things over to Kim Myles from Wintrust.
Thank you everyone for participating in the event today. For those that are unfamiliar, Wintrust Community Advantage is a division of Wintrust, which is a large bank near Chicago. Wintrust Community Advantage has delivered association banking services for 21 years, and we're an avid supporter of CAI education in multiple states. In keeping with that tradition, being a Chancellor education sponsor for 2 years in a row provided a rewarding way for Wintrust to support this chapter's generous members in their effort to encourage education and knowledge of best practices in our region. I'm in Alexandria, Virginia, and I participate on many committees and serve as co-chair of the Public Outreach Committee. I've taken full advantage of those education programs offered and received my Educated Business Partner designation, as well as CMCA, with my thanks to the CMCA study group for making that possible. To start our introductions of all the panel members, I'd like to say that I read this quote from Mark Twain and I thought it characterized the people on our panel. Mark Twain said, "Really great people make you feel that you can be great too." And so with that, I'll start with our panel introductions. Ken Chadwick is Esquire and principal and founding member of Chadwick, Washington, Moriarty, Elmore, and Bunn. He's a fellow of the College of Community Association Lawyers and served as a past president of our chapter and remains active today. He's joined by Will Washington, also a principal and founding member of Chadwick, Washington. Will is a fellow of the College of Community Association Lawyers and a frequent lecturer for CAI. And Will too has served as a past president and remains an active member of the Washington Metro chapter. We're thrilled to have our current president, Airielle Hansford, joining us today. Airielle obtained her CMCA, AMS, and PCAM designations after many years managing community associations at all levels. She's Vice President of First Service Residential and a frequent speaker and reliable resource on the topic of best practices for our chapter. We're also joined by Jessica Knutsen. Jessica is Vice President at USI Insurance and has been practicing insurance for 15 years. Jessica's specializing in insurance programs and risk management plans for condominiums, cooperatives, and large HOAs. Jessica holds the Certified Insurance Counselor, or CIC, professional designation. Jessica was elected as the 2020 Business Partner Council for CAI. Congratulations, Jessica. Finally, our moderator, Don Plank. Don holds a PCAM designation and managed community associations as both a site manager and portfolio manager for 9 years before assuming his current role as Vice President of Association Banking Services at National Cooperative Bank. Don is involved in multiple CII chapters and serves on various committees. And in his spare time, he serves on the board of Sarah's Circle, which is a nonprofit dedicated to providing affordable housing for seniors living in DC. So Don, we thank you for your efforts and take the floor, please.
Thank you, Kim, and welcome everyone. First of all, let me thank you for all the questions that were sent in. We will have our speaker panel address as many of them as possible during the time we have today. So diving right in, the first category we have is business continuity, financial solvency. And before I move on, I just want to reiterate what Suzanne said about the part one that we did a couple of weeks ago. That part, a lot of it was geared toward essential versus non-essential services. And you can find it on the chapter's website. Just go to the chapter site, caidc.org, go to the events section, and then the upcoming virtual events, and it'll be at the bottom of that page, and you can find it there. So in our first category, Airielle, how can associations assist owners who cannot pay assessments because of COVID-19 loss of income? Are there forgiveness or delay options?
Thank you, Don. So the board's responsible for ensuring the financial health of the association, and this includes timely collection of assessments. So they still have an ongoing duty to collect assessments even during the COVID-19 pandemic, and in a manner that's best for the interest of the association and the membership as a whole. So boards may consider waiving late fees or interest payments which come due during this time, but really these should be considered on a case-by-case basis. They don't necessarily want to change their collections policy. They can also agree to more liberal payment plans for owners, and these should be documented in writing. Of course, they want to talk with the association's legal counsel before making any changes to their collections process. And if they do enter into any agreements, if they do make these changes, they should definitely advise their management agent as well as their collections attorney.
Thank you, Airielle. Will, how should boards proceed with the collection of delinquent assessments?
The collection of assessments is an interesting issue these days for a couple of reasons. One, obviously, the circumstances involved are beyond the control of a great many of the owners in place there. And there is some consideration of legislation on the Hill currently to disallow the collection of assessments. And the district has also adopted an emergency regulation that suggests that they are against the collection of assessments or of money by those that are owed, but they have not expressly banned condominiums or homeowners associations from doing so. Congress might be considering doing that now if they aren't stopped. The process can go on, and to the extent possible should go on, but there should be some understanding, and I would suggest it might be beneficial for the associations to consider some leniency with regard to some of the penalties associated with it, and or a capacity to allow forbearance to give people time to get back on their feet after they are getting paid again. So those things should be considered on a case-by-case basis, or if you want to adopt a policy to address it, you might, but there are ups and downs with that. Having a policy will encourage people potentially not to pay that might otherwise be able to pay. So keeping the flow of money going is something you want to encourage. So I would suggest that dealing with the case-by-case and circumstances that warrant it would be the better way to approach it. For someone who's been paying on time for 20 years that suddenly can't, should be considered. Someone who's always delinquent, who may actually be still getting money, should be reviewed to make sure they're not taking advantage of the circumstances and hurting the association in the process.
Thank you. Airielle, what resources are available to our community for those going through non-financial tough times? And this question is referring to things such as mental health resources, food banks, etc.
Sure, there's a wide range of services being offered by local agencies, nonprofits, and businesses for residents that need food, other resources and assistance during the COVID-19 pandemic. So DC Public Health has meal delivery for seniors. They've even set up a hotline for residents that are homebound due to COVID-19 so that they can request support from the district for food and essential items. So most of the local jurisdictions have established dedicated resource response web pages that detail those services and resources available to their residents. I also encourage you to visit the Washington Metro Chapter's COVID-19 resource page at caidc.org.
Excellent. Jessica, what are some options to an association that is not able to pay its bills? Things such as insurance payments and utility payments.
Hi, Don. So I can answer for insurance payments, and I actually have really good news. And this applies not only to associations, but also your residents and their tenants, and even the business partners who are in the webinar with us today. So the National Association of Insurance Commissioners, NAIC, has made a special request to all the state insurance regulators to provide some relaxing due dates for premium payments. As a result of that request, we are seeing that many insurance companies are adjusting payment periods from 30 to 60 days, sometimes even 90 days. If your payment is already past due, they are actually willing to work with you and waive any late fees and provide a payment plan so you don't have a lapse in coverage. But please keep in mind that because the insurance companies are following the orders from each different state, the flexibility level is going to be different. So I highly recommend that you reach out to your insurance broker and evaluate the different options that you will have from your insurance carriers. Now, for other utility payments, I'll ask Airielle to cover that part for you.
Excellent. Airielle, do you want to follow up?
Sure, yeah. So I think it's important to talk to service providers and creditors and ask for payment plan or an extension if it's necessary. Many utilities and telecommunications companies are actually easing shutoffs and waiving late fees in order to accommodate consumers who might be struggling to pay during this pandemic. But don't wait to reach out to folks. Talk to them before the due date or as soon as you know that there may be an issue with being able to pay.
Good advice. Thank you, Airielle and Jessica. Our next question is, are associations eligible for any of the COVID-19 SBA funding programs? And I'll speak to that a little bit. So there are two main funding programs. The one that has gained the most press coverage is the SBA PPP loan program, and PPP stands for Paycheck Protection Program. And that money ran out, but if the House acts today, they're authorizing another $310 billion for this program. And basically, that program, you take the average monthly payroll, use 2019 as the backdrop, take the average monthly payroll, multiply it times 2.5, and you get your loan size. And the attraction to it is that if you use it appropriately, at least 75% for payroll, and then the other 25% up to for interest, rent, that kind of thing, it can potentially be forgiven. It has to be used within an 8-week period after you get the money. And since a lot of the associations or co-ops have their own employees, there's been a lot of interest in whether they can apply to this program. Unfortunately, the answer is no. they are not eligible. But a lot of management companies have applied, a lot of business partners in our industry have applied, and they continue applying. If you're on the call and you belong in one of those groups and you haven't contacted your lender, this program has to be done through an SBA approved lender. You should contact them as soon as possible, because everybody believes this next round of funding will be gone very soon, because what happened is there was a big demand for it. A lot of people didn't get it. And so banks have been gathering those applications, and they're sitting there waiting to be uploaded to the SBA system as soon as it opens again, which could potentially open Friday morning if they go ahead and approve it. So, but unfortunately for the associations and co-ops, they're not eligible. The other loan program that has gotten some interest is the EIDL program, which is Economic Injury Disaster Loan. This is similar to what the SBA has approved in the past when hurricanes have come through or some other natural disaster like that. And it's important to remember that this is a loan. And so co-ops, our understanding is that co-ops can apply for this. The interesting thing for this one is that up to $10,000 is turned into a grant. The rest of it is a loan. There's a huge backlog for this program as well. It ran out of money, and they're potentially approving another $50 billion and another $10 billion that can be turned into grants. I was doing a little bit of research. The CAI has a good page on both of these loan programs. If community associations are incorporated as nonprofits in their individual states, they are potentially eligible. This loan program is administered directly through SBA, so your bank will not be able to help you with it. So the chapter has a link to resources on both of these loan programs, or you can go to sba.gov. You can easily find it on their website, and you can find information about both of them. Anybody have anything else to add on those two loan programs? Excellent. Will, how are associations handling homeowners who don't want to pay because amenities are shut down?
You know, as I sit here looking out over my beautiful, unusable pool, I ponder that question myself. But the truth of the matter is that the issue has arisen even prior to this current situation, where certain times amenities are shut down and people argue they don't have to pay their condo fees or their association dues, but that isn't typically true. Most documents provide expressly that you can't use that as an excuse not to pay your assessments, and there are a number of cases that support that proposition that you are covenanted to pay. You still get the benefit of having those amenities as part of the increasing your property values. So even though you temporarily can't use them for your own good, that does not give rise to a legitimate argument that you don't have to pay your full assessments.
Thank you, Will. Will, should boards agree to waive late fees and other similar penalties? This is kind of a follow-up to that, what Airielle addressed earlier.
Sure. In a number of cases, boards are considering and certainly can reasonably consider waiving penalties associated with non-payment for those that are appropriately not paying because they can't due to the situation here. I think that's a good policy to employ for those that are legitimately unable to pay because of the crisis, and it shows the kind of latitude that one should give to help all of us get through it together. It's not the same as waiving the responsibility, and when the time comes due, all should pay their assessments, but tacking on a late fee at this time is something that is certainly reasonable to forego.
Jessica, our last question in this section. Any advice on 2021 budget preparation, things that a board should be aware of?
So this is a tricky question. I don't want to scare anybody, but I do want to share some background information with you. So as of the first quarter of 2020, before the virus expanded in the US, the insurance industry was already hardening as a result of $200 billion in property damage, mainly due to global catastrophic events. So like the wildfires in Australia, and the hurricanes in the US. So we have been seeing a lot of large increases, I would say between 5 to 10%. And we're also dealing with higher property deductibles and new deductibles. So you've probably heard about a per unit deductible or water damage deductibles that go as high as $100,000. So the carrier's capacity is shrinking. And if you incorporate COVID-19 to that equation, I think it would be safe to anticipate and definitely plan for rate increases for 2021. You might need to consider increasing your property deductibles voluntarily to protect your loss activity and maintain your insurability. And that's also going to be the only way to basically reduce the increase that we're anticipating for 2021. So I encourage you to discuss this with your insurance broker at least 60 to 90 days before your insurance program expires. You definitely need to take a proactive action on this. And Airielle will help you with the rest of the budget planning.
Awesome. Thank you, Jessica. So now it's the time to really look at service agreements to make sure that they meet the needs of the association. So reach out to service providers and discuss the contract with them. Open dialogue can ensure that the property is serviced at the appropriate level. There may be things that they are going to need as a result of the COVID-19 pandemic, or things that they may not need if it continues. So considering those expenses that the association may incur due to a resurgence of the virus next year, as well as that result as a fallout. Additional cleanings, that's something that we're already seeing for 2020. Allowances for personal protective equipment, PPE, cleaning and sanitation supplies. You'll want to fund for increased utility costs. If we have residents sheltering or working from home, we're already seeing those skyrocket, to plan for that. And then, of course, increased legal and collections fees. We can anticipate that those will be higher than normal. I also recommend that associations establish an operating contingency fund as part of their operating budget. This is a great way to ensure that you have funds for unanticipated expenses, and it can also help build the association's unappropriated owner's equity if that goes down.
Excellent. Sounds like a tough budget planning season. So I see a couple of questions come in. We need to keep moving to get through the others, but if we have time, we'll come back and try to answer some of the questions that we have. Our next section is pending work and contracts. Airielle, how should installation of windows be handled by a contractor who enters a unit?
Sure. Well, so for the purpose of this answer, I'm assuming that we're talking about an emergency repair, or maybe this is a large replacement project that started before the pandemic. Contractors should be required to use the same PPE per the CDC's guidelines, including mask and gloves, and they need to stay at least 6 feet apart from others if at all possible. Reach out to the contractor and talk with them about their protocols and discuss the association's expectations. And be advised that if there are additional expectations that weren't outlined in the original contract or agreement, that there may be additional costs that are incurred if the association has requirements that are outside of the CDC guidelines. Then I think that that's reasonable, but make sure that you, again, have open dialogue with service providers.
Great. Will, is there any health risk of landscape crews using blowers on a property that might transmit the virus through the air?
Sure, and just to drop back a quick second on Airielle's issue, if they are coming into work in a unit and you know that the unit that they're going to enter has somebody that is sick with COVID-19, then you also want to make sure you follow the CDC's guidelines as well as the OSHA guidelines with regard to making sure the people that enter into that have appropriate disclosure and protective gear to protect them from that, and if there's appropriate separation, if it can be entered at all. With regard to the question at hand, none of the area jurisdictions have laws that or rules or regs that say that landscaping is prohibited during this time. It is one of the jobs that is allowed to be done. There's no restriction on using blowers. So with that understanding, I don't see any reason why you would have to worry about somebody using a blower. It isn't likely that it's going to include or be loaded with the virus. It'll be pushing the same air that the wind would push around anyway, so it shouldn't present a problem.
Thank you. Ken, do reserve studies qualify as essential in Virginia since they are required by the state?
Well, Don, you better believe if they've got reserve specialist standing, they do consider themselves essential. That's for sure. Whether they're looked on as essential for purposes of the states and the District of Columbia, the answer is that they're probably going to be looked on as essential, because when you think about it, all of us are in a stay-at-home mode. We're all in our residences, and we need to make sure that those residences are in fact maintained, well maintained and well provided for, so that we can literally stay in home or stay in unit or stay wherever we are at this point in time. So the answer is, I think that they would be considered essential. I think especially as it regards high rises and mid rises, as opposed to homeowner associations, there is obviously more of a need and a demand to make sure. But if you have a situation where you're up against that timeline, I would suggest to you that it would be appropriate to go ahead with those services.
Excellent. Ken, with regard to pending construction issues and projects, in light of that, the pandemic, can they move forward?
The answer is, it depends upon the association, what type of association it is, whether it's high-rise, where the work is going to be done. And Airielle's point, I think, is well taken in terms of the first line, is the communication with the contractor itself. That really needs to be done. The association needs to reach out to the contractor to coordinate with them as to whether it is appropriate or not appropriate, what standards, what safety precautions, OSHA or otherwise, CDC, all those things need to be taken into consideration, because things have drastically changed from the time when that contract was first entered into. So we need to be talking with our contractors, with the board and the management company directly involved in those communications. I think it's very important to realize too, that if you're going to change things, shake things up with the contractor, you need to make sure that those things are in writing. We're having a lot of comments from our clients indicating that they want us to take a look at their existing contracts. Well, unfortunately, these contracts aren't ones that we've seen before now, but all of a sudden there's a plethora of contracts that we're seeing for the first time. And that's not when we ought to be seeing them. We ought to be seeing them when they're being drafted, not when they're already executed. And so you have some contractors who have already taken the steps to reach out with addendums to contracts that are existing. And all of those addendum are going to be dealing with issues in the body of the existing executed contract. There's a problem there in the sense that, first of all, what's the consideration for that addendum? Just giving an addendum and signing an addendum doesn't necessarily make it an official addendum if there's no consideration involved. And if it's one-sided, there's obviously no consideration involved. So when we're looking at those addendums, when we're looking at those contracts, when we're communicating with our contractors, we ought to be talking about what's going to be best, how are we going to move forward with the underlying contract, and what we're going to do with regard to any addendums that we need to put into place, much as we would put in change order requests for the purposes of making sure that all sides are protected. But there also has to be an offer, an acceptance, and consideration involved, and we need to make sure those exist.
So when you say consideration, are you talking dollars?
It could be that. It could be the idea that things have changed in terms of the COVID-19 situation, and that we're taking that into consideration, so to speak, and that as long as we work together and put that contract and addendum together as part of a comprehensive package, we'll have what we need in terms of offer, acceptance, and consideration, which are the three key elements of a contract situation.
Excellent. So this is not the time to just sign a proposal.
It's not. It's not the time to sign an addendum. It's not the time to sign any contract or a proposal unless it's been reviewed by legal counsel. If you want to protect yourself, one of the key things now is everybody's looking to see whether their contract has a force majeure provision, and what that is one that says if something comes up that we weren't anticipating, that's referenced in that provision in the contract, that we will then be able to maybe get out of the contract or dependent upon how the force majeure provision is drafted, we may be able to do various and sundry things. Once again, jurisdictions play a different role in terms of interpreting that force majeure. In Virginia, it is very limited to what the provision says, and I will almost guarantee that none of them talk about COVID-19 in the force majeure provision. So then you're really looking at, in Virginia at least, whether the contract has become an impossibility to perform. In other jurisdictions, there may be more lateral and expansive interpretations of what force majeure is, but you're always going to go back to the original contract and determine whether, one, there's a force majeure provision in there that talks about acts of God, acts of war, whatever, and also what the limitations or scope is to that force majeure provision. So it is a critical provision, but if you hadn't looked at it beforehand, you probably don't either have one or you don't have one that's going to protect you from COVID-19.
Fascinating topic. We would probably do a whole session on contracts.
I'll be back next week.
Yes. Will, is rolling out a brand new service such as an internet service provider essential when we already have a couple internet service providers?
Well, God knows in this day and age, the internet is essential, and I don't know how any of us would get by without it. But with regard to a building that has two providers already in place and they're considering a third, whether it's essential or not is an open question subject to interpretation by the board. There's certainly an argument that that's the kind of project that one might put off until later, when it might be deemed safer to go forward with having people in the building or in the units, getting things wired or installed. So that one can make that argument. But in terms of it being a project that's fully essential, if the building deems that the additional coverage or the savings in price make it worthwhile, the board could indeed deem that an essential project.
How about something like HVAC spring inspections? Are those considered essential to move forward with? And I guess this time of year, a lot of communities are doing that type of thing.
That's a very good question, and I've handled that question with multiple buildings in the last several days because it's getting to be that time. If your building has a history of convector backups, condensation line backups, a number of leaks that will arise if you don't properly maintain them, then it is exactly an essential service, because the downside of not doing it is that you'll have more extensive and more intrusive work that you have to do to address the problems that will arise that you could have avoided. So certainly that's the case. If it's the kind of work where you have people inside and it's really just a cleaning and it doesn't really impact problems, you don't really have leaks associated with that, then deferring that type of work might be something that you could consider.
Excellent. Will, what are some requirements for contractors who work outside with regard to PPE?
Well, certainly with regard to any contractors on the property or the residents, following the CDC guidelines is something that's recommended, so that it would be appropriate for everybody that's around on the property to wear masks. Maintaining social distancing is appropriate, but the downside risk of somebody infecting or being a problem for anybody in the building that's doing work outside is pretty low. So if you follow CDC guidelines, you should be in good shape.
Excellent. Ken, back to our favorite topic of contracts. Is COVID-19 a valid reason to cancel or modify a contract?
Once again, that's going to be dependent upon the contract in part. It's also going to be dependent upon what the executive orders say with regard to essential services, whether or not there is invasiveness on the part of the contractor into units, where the work is being conducted. You also have the idea that if we're all staying in home, if we're all sheltering in place, so to speak, how disruptive is that work going to be to those people who are working from home? Those are things that boards need to consider, that whether it's a common area or common element contract that's being performed, or whether it's a in-unit contract. I know that many associations have adopted rules and regulations related to ongoing projects and potentially new projects, where they have indicated to their homeowners that in light of the COVID-19 situation, the restrictions in place, the executive orders in each of the jurisdictions, in each of the local jurisdictions, that they are taking a very strong position about anything happening that is going to expose either the members or staff or others to individuals who don't reside within the community. And so under certain circumstances, I would suggest that once again, you pick up the phone and you talk to your contractor, or you make sure your members understand what their rights are pursuant to the newly adopted rules and regulations governing access to the building, governing access to units, use of the elevators, which we talked about last time. All those types of things need to come into consideration. But once again, it's a matter of communicating, making sure that the contractors are aware of the concerns, making sure that they're taking their steps to protect themselves, their employees, but also more importantly, that they're taking steps to protect our residents, our members in-house against this dreaded disease.
Excellent. Ken, this next one's for you too, and every manager with a pool is thinking of this. Should our HOA and the pool company continue with their pool opening preparations? And
to that, Don, I reply, let us pray. The answer is, once again, go to the contract that you've got. And what we've been seeing is a number of pool contractors coming out with addendums, some very positive and proactive in nature, some a little bit less so. So be careful about the addendums and just signing off on the addendums. I make that disclaimer now. Make sure that you know what the local jurisdictions say about whether or not pools can be used. For instance, in Maryland, they're considered a facility, a rec facility, and that they are, at this point, supposed to be closed. In Virginia, it's an interesting situation because the governor didn't come out in his executive order and necessarily indicate that pools are supposed to be closed. But if you go to the fact sheet, the FAQ sheet that's on his website, it is clear that both public and private are supposed to be closed, which is kind of an interesting situation. And thus, when can you open it? Well, you know, we in Virginia anyway, our executive order goes until the June timeframe. In Maryland, I think or in DC, it's the 15th of May. And in DC, currently, or I mean, in Maryland, it is currently open-ended. And so if you're in a situation where you're in a jurisdiction where the pools are supposed to be closed, you don't know exactly when they might be opened, and you may think that it's wise, and it probably is wise, to at least follow the contract terms in terms of the pool opening requirements and operational requirements to get the pool up to speed. But then you also ought to be talking with your contractor about what you need to do to maintain that status if all the orders are extended. How do you maintain a pool that's not being used, and what's the most effective way of spending the association's money in that regard? Those are types of things that need to be considered and need to be worked on between you and your contractor. And there are ways of dealing with it, and most contractors are going to want to work with you as an association, but make sure once again to pick up that phone to talk to them.
Have you had any boards or managers talk with you about, when they open, like maybe opening with social distancing? Like, is that even something that's being discussed?
In some situations, the answer, for instance, it's not really clear in DC what the story is with pools and outdoor pools versus indoor pools. And so can you have social distancing at a pool? How are you going to enforce that? There are many concerns that arise in a pool setting, especially when you consider that it's not so much when the individual is in the pool, unless there are 100 people in the pool at the same time, which then gets, all of your executive orders are violated at that point because you're not supposed to have gatherings more than 10 in most of the jurisdictions. But you also then have the 6-foot distancing requirement. So how do you control? Are we going to start lining up outside the pool like you do at the grocery stores and making sure you're designated 6 feet and you wait all day to get into the pool, and then it turns out that the pool ends up being closed because it's closing time? I don't know how they're going to deal with that. In some cases, a pool could be considered, and is in many circumstances anyway, an attractive nuisance. And so you've got a situation where the association's going to be in control of that pool. It's their property, their responsibility, and they may end up taking on more liability. And that's where we're going to turn to Jessica and say, help me. I need that liability coverage protection even more so than I thought. So make sure I'm covered, Jessica. Make sure I'm covered.
Have you had anything like that, Jessica, where you've had people contact you about pools?
Yeah, we have had some calls, but same as Ken is explaining, some people have actually even mentioned trying to see if they can do slots, like time slots for different residents to take turns and use the pools. But I mean, you're just going to get yourself in a bigger problem. So I agree with Ken. I think it's just better to take a different action and just not offer that amenity for the residents.
Thank you. Turning to our next topic, which is human resources and personnel. Airielle, are site managers considered essential service workers?
Sure. So we went into this in great detail during our first webinar. But in short, those workers responsible for handling property management, maintenance, and related service calls are considered essential service workers.
Excellent. As a follow-up, how about, does the same apply to all management company employees?
So I would say no, not all management company employees are going to be considered essential. And this would depend on the nature of their role and their job responsibilities.
Excellent. Very specifically, and with regard to on-site properties, should a general manager be required to be there? An assistant general manager, maintenance coordinator, front desk personnel? How have you handled this?
Well, so this is going to depend on the association, the building, and the needs of the community, right? So the needs of an HOA are going to be vastly different than those of a high-rise condominium. The services that are being provided to the residents and I think they can vary greatly. Communities rely extensively upon the staff for the provision of necessary day-to-day services and those especially that safeguard the health, safety, and welfare of residents. So I would say, those employees that are necessary on site would be those that are responsible for providing day-to-day operations, facilitations of deliveries and other necessary services, maintenance and monitoring of critical systems and responding to emergencies, and those that are working to accommodate the needs of isolating or quarantined residents or being utilized for increased cleaning regimens. So just because someone is essential, do they need to be on site at all times? I think that when they are there, it's important to limit staff interaction, whether it's with each other, with the residents, with service providers. Consider allowing remote work if it's possible. This may be much easier for a manager or an assistant manager, a maintenance coordinator. That could be part of their role, could be done remotely. You want to avoid group work and having the staff in close proximity, so staggered lunches and breaks, staggered longer shifts for the front desk and for maintenance personnel or security attendants. And you can even operate on 12-hour shifts if it complies with municipal orders. Long answer.
A good one. Thank you. Airielle and Ken, if both of you can speak to this regarding masks and physical distancing, what is the new order out there that people should be following?
So employees and service providers that are on a property, so whether they're part of the sited staff or they're just visiting, they should be wearing a face covering as described by the CDC. Well?
Yeah,
Actually, Ken.
Oh, Ken, sorry.
Oh, that's okay. We both answered the same name. The answer is the daily double. The reality is that jurisdictions differ in terms of the requirement. If you go as far north as Pennsylvania, you find out that they have a mandatory requirement. Well, that kind of has dribbled down to Maryland now, and Maryland, under an extended order from Governor Hogan, has indicated that it is mandatory to have those masks in public places, public transportation, and it's important to be wearing them at all times. With regard to DC has taken the position that when you're in a food store, retail store, other types of public areas, you ought to be wearing one. Virginia, on the other hand, has taken a lesser position in terms of requiring it. They've recommended it, they urge it, much as the CDC has recommended it, they're recommending it, but Governor Northam has not made it a requirement as of yet. It is kind of surprising, especially with the CDC's requirements, that at least in our area in Virginia, we don't see more people at the stores wearing the masks. And I think it might be beneficial if the governor did, in fact, make it mandatory to protect, once again, us all from this situation. So it is different in each jurisdiction as to the requirements and whether it is a requirement or not.
Excellent. Going on to our next topic, which is board action and authority. Will, what are some ideas on how best to lift the access restrictions in a high rise?
Heresy. The access restrictions, I wouldn't say that there's a best argument for lifting them, but I think in terms of implementing appropriate access restrictions, that the best thing to do is to have an educated board and membership that is following the ever-changing and evolving guidelines offered by the jurisdiction and the federal government and its agencies, to be as informed as you can as to what's actually helpful and what the benefits are, be cognizant of where people are going to go and what they're going to be exposed to, and tailor them appropriately. A arbitrary selection of a number for a high rise of people allowed in the building without some idea of where they're going in the building, what they're doing in the building, doesn't sound like it's appropriate, but a well-considered one that's tailored to the actual access points and work that's going to be done or visitation that will be allowed, could be solved if it was done appropriately.
Excellent. I guess you pretty well addressed the next question, which was to what extent can a board limit access to the building during stay-at-home orders?
Sure.
Does the board have that authority?
Right, they do, and it is always look to your documents to see what authority you have, but generally speaking, boards have the authority to regulate the common elements, and you can't get in the building without going through common elements and most condominiums. Same with regard to the common areas and homeowners associations, although the need is much lower in those circumstances. But if you're within your authority and you're doing what's reasonable under the circumstances to address the legitimate concerns of the community, then the board would be, I think, given fairly wide latitude with regard to doing what's in the best interest. Buildings that have very senior communities or more people that are at risk are going to be allowed to do more with greater authority. Certain properties that are senior housing or facilities for people that are sicker have absolute bans with regard to people because anybody there is really highly at risk, and that's acceptable. Regular condominiums with a broad mix of people are going to have less of an argument for any kind of an outright ban, and you'll need to do something that's more tailored to the kind of access and the kind of risk that you actually have there.
Excellent. Ken, my board is allowing caregivers access to the building, but there is no clear definition of that term, leading to wide interpretation. What advice can you give?
I think with regard to this question, we need to be very careful in terms of how we're responding to it. We should never obviously react to this kind of a situation. We should respond to it after giving it careful consideration. Because it could lead arguably to a fair housing claim. If an individual is handicapped or disabled in any way, the individual, if they're in need of that service and can show that they have that service coming to them on a regular basis, they need to make sure that the association needs to make sure that they're not violating any rights that an individual has in that regard. In terms of who is a caregiver, I think you're looking at almost anybody, especially dependent upon the situation, whether it's a disabled person, an elderly person. You need to take into consideration the facts. You also need to take steps to protect the association so that they understand and have a record of why they considered the individual coming to the unit a caregiver. And it could be a relative who periodically comes by to either check on or to help in some certain ways, but there should be a record of that coming from the unit owner who's requesting it, and there should be an understanding of what the status is of that individual that you're letting in. So is there a likelihood that the definition is going to be broad? The answer is it is likely. That doesn't mean that you should prohibit them from coming in unless there's another reason for doing so.
So if you allow them to come in, and as you outline, can you require that maybe they wear a mask or have to have gloves if they use the elevator, that kind of thing?
Once again, that goes back to Will's point about A, check your documents, but B, when we're talking about common elements or common areas, there's generally broad authority on the part of the board to adopt reasonable rules and regulations. And what is reasonable now may not be what is reasonable a year, 2 years from now because of COVID-19. And we need to adjust our reasonableness standard, or maybe not the standard itself, but what we consider a reasonable rule in light of the circumstances that we're facing.
Excellent. Airielle, which package deliveries through the concierge would you consider non-essential in this question, but I guess the opposite could be posed as well, what you consider essential?
Well, you know, I'm not certain that we actually have the answer to this question, right? This is virtue ethics. But the reality is that often we don't know what's actually being delivered to someone. And I don't know that we can make a decision or discretion on what they consider to be a vital need. E-commerce is booming, and especially as more and more people are sheltering and working from home. So in addition to food, medication, necessary personal care, and household goods, residents may need supplies and gear that's necessary for remote work and educating and entertaining children. It can be a scary time right now to go out shopping, and so people may find it more convenient to have items delivered. And the longer that we go into this, you know, there are those items that people may feel are a necessity. It's a psychological need, right? So what gives them security? So with that in mind, I think the association needs to implement protocols for package delivery distribution that protects both the staff and residents. Of course, handling packages with gloves and clean hands, implementing contactless package delivery. So that's where we designate a spot so that residents stand away while they're waiting for a package, and that's a dedicated pickup area for staff to place packages that they can walk away from. And consider having oversized packages delivered to the residents directly by the carrier. So calling to arrange that, I think, is important.
Excellent. Okay, we're coming up on an hour, but let's try to squeeze in a few more questions. Ken, what are best practices for virtual board meetings in order to comply with, in this case, Virginia POA Act?
It is my privilege to announce for the first time on a webinar anywhere that Virginia has recently passed legislation. The General Assembly has passed legislation that were actually amendments made by the governor of Virginia that will do away with the two-person requirement in Virginia for condos and property owners associations during times of declared emergencies. So the governor added some language to a couple of bills, and we are waiting now literally on the edge for the governor to sign them. We don't think that he's going to undo the amendments he himself proposed. But they have not been signed, and they have not been signed into law yet. But both houses have passed the laws, and it will allow for boards to meet virtually under certain circumstances with certain protocols in place, to meet virtually without the need to have two members of the board in a room that members can also attend physically. So the reality is that we will be in a situation with this law change that will get us out of the requirement for that two-person rule.
That's excellent news.
And you can thank the Virginia LAC for that.
Awesome. So Suzanne, I'll turn it back to you since our hour's up. And do you have any follow-up that you'd like to add?
Thank you so much, Don, for being an excellent moderator, and thank you to our all-star panel for being willing to come back for part 2 of our discussion. We are also grateful to our sponsors for today, Wintrust Community Advantage, USI Insurance, and National Cooperative Bank. Attendees, we hope you found this discussion to be helpful. Please complete the Zoom poll before you leave the session today to tell us how we did. Plan to join us for future virtual sessions. The chapter is planning a number of virtual education sessions that will unfold over the following weeks. Please look out for the notices of the details once they have been scheduled. You can always check our COVID-19 resource page at caidc.org for the latest updates. In the meantime, stay safe, stay healthy, and enjoy the rest of your day.
Thank you.
Thank you. Bye-bye.